Hello and welcome. My name is Chris from ChristopherHall.com, and welcome back to this little mini series overviewing injuries. In the last video we talked about the three different types of injury. In this video we're going to talk about different tissues that are involved in injury and then how we can go about treating and rehabilitating those tissues. Now I've sort of bullet pointed 6 different tissues. The first one being muscles, then ligaments, tendons, bones, fascia, and nerves. Now, we all know muscles. It's these big red bits here that contract, that can pull on a bone and create movement. That's how we understand muscles. Then we have ligaments, which connect bone to bone. Then we have tendons, which connect muscle to bone. Then we obviously have the bones themselves. And we have this thing called fascia. Now, I'll quickly just overview fascia a little bit more than I have the maybe more familiar muscles, ligaments, tendons, and bones. Now, fascia is a connective tissue that joins your foot to your shoulder, if you will. It's a interconnected web of tissue that lies in between all of your muscles, all of your ligaments, all of your tendons, through your bones. So it's connecting the whole body together. So if you, like this sort of picture describes or demonstrates or illustrates, if you pull on the fascia by your shoulder, it could affect the fascia by your hip. Or if you pull on the fascia on your knee, it could affect the fascia or the tissues on the inside of your leg. Now, what this is meant to describe is that the site of the pain isn't always the site of the injury, if that makes sense. So again, it's very much sort of understanding that. Then we come on to the nerves. Now again, the nerves can be the same. The site of the injury may not be the site of the pain may not be the site of the injury, because if the nerves here, which connect your spine here to your muscles here, so if you have a tight muscle, for example, that might not be the muscle that's tight. It might be the nerves activating the muscle, giving it the illusion that it's tight. So by understanding what tissue is, let's just say, injured, we can then understand what type of therapist or therapy that we need to get. For example, if we have a muscular injury, if it's a tear or like a knot in the muscle, for example, it's an injury to the muscle. It's not an injury to the nerves. It could well be an injury to the fascia as well, because it's interconnected and connected to everything. But essentially, it's a injury to the muscle. So what we would do is we would obviously have a period of rest to allow the inflammation to go down. If we need any surgery or anything like that, we would go and have it. But for the most part, we wouldn't need that. So we would just give it time to settle. Then we might go and see like a massage therapist or a sports massage therapist or a physiotherapist who might administer a massage or something like that. Because what they will then do is they will treat that injury with manual therapy by pushing their thumb into it or just warming it and delivering blood using massage therapy or sports massage therapy. If, for example, it's a tight muscle or a tight joint, we might go and see a chiropractor. Now, chiropractors don't just work on spines, they work on the nervous system. So if it's a tight muscle, as I've described, that is being activated by the nervous system here, if it is that in that case, what we would do is a chiropractor would treat that neural reflex, and then that would correct the tightness of the muscle, if that makes sense. So what we can see from these different types of tissues is we then understand better what type of therapist to go and see. So in a part of sort of ours as humans, but yours as the person listening to this that has a potential injury, is to go and get a few opinions as to what your injury is. Is it the muscle? Is it the ligaments? Is it the tendons? Is it the bones? Is it the fascia? Is it the nerve? Because what you can then do is then go and choose your therapy or therapist with a little bit more information. So it's worth going out speaking to a few different therapists, asking them to assess you, getting a few different opinions as to what the injury is, then making up your mind, well, that makes most sense to me, therefore I am going to have it treated in this way. Because there's a lot of noise around like the neural part of the injury, so the nervous system keeping the muscles turned on. Now, if it's not a nerve problem, if it is a tear in the muscle or if it is a knot in the muscle, then don't go and have it treated by someone who deals in the nerves. Go and have it treated by someone who deals in the muscles, in the ligaments, in the tendons, for example. But if it is a tight joint or a tight muscle that is neural, then it's worth going to see one of them and not necessarily going to see a massage therapist, for example. So hopefully this has sort of given you a little bit more of an insight into how to go about rehabilitating and recovering from an injury. What I'm going to do is put together a series of videos on different injuries that will hopefully give you a better insight as to who to go and see. But if you don't get around to watching those, please do go out and get a few different opinions, understand your injury a little bit better, and then go and get the appropriate therapy or rehabilitation from that. So many thanks for watching. My name is Chris from christopherhole.com, and I will speak to you in a future video.